One of the most common diagnoses that we treat here in clinic is shoulder pain or shoulder pathology. And what I would like everyone to consider is that the shoulder is the base, if you will, for your hand. In other words, it's often said that the things that make us human are our ability to communicate with language and our opposing thumbs. Well, you can't effectively use your extremity without a really solidly functioning shoulder. Just imagine it. If your shoulder was completely dysfunctional, how could you use your elbow? How could you use your hand? The hand is basically the extension of your shoulder. So as physical therapists, whenever a patient's referred for shoulder dysfunction, we take it very seriously. We screen the neck, which is appropriate. We screen the shoulder girdle, as we like to call it, because the shoulder is in fact a part of a girdle system. In other words, you have two of them and they are exact mirror images of one another. The shoulder by nature is one of the most unstable joints in our entire body, but it is also one of the most mobile joints in the entire body. Essentially, the things that lend stability to our shoulder are simply just the rotator cuff, which is the collection of four muscles, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. One ligament that we call the glenohumeral ligament that has three separate sections to it, and what we also call a joint capsule or a synovial joint capsule, which is the structure that helps to keep fluid in and around the joint to nourish the articular cartilage structures and to decrease frictional forces between the ends of the bones involved at that joint. Now, we also take into consideration what we call the AC joint and the SC joint, which are the joints that are comprised at either end of our clavicle or our collarbone. And then we think about the scapula, which rotates upward and downward across our rib cage in the back. So the shoulder isn't as straightforward as it might seem to most people. In clinic, when evaluating a shoulder, after clearing all of the red flags, the big, the bad, and the ugly as we refer to them, what we typically do is to examine the biceps, the rotator cuff, the ligamentous structures, the capsular structures, and then take a very thorough biomechanical approach to maximizing shoulder function. Again, what are physical therapists? We're essentially movement doctors. And when we look at a shoulder, we have to take it in the context of how the entire torso and sometimes how the entire body is working. We have to look at the position of the patient's upper thoracic spine, the section of your spine that's between the shoulder blades, the position of the head, whether it's too far forward, too far backward, etc. The position of the shoulder blades, are they too far forward and downward? Are they too far downward and inward, etc.? And after a thorough biomechanical assessment, strength assessment, neurological assessment, we begin to recognize patterns that are inefficient, that we can retrain, re-educate, both with strengthening exercises and neuromuscular facilitation techniques to maximize the total overall function of the entire shoulder girdle as it pertains to the entire movement system of a person's body. Again, the shoulder doesn't work in isolation. It's got many, many, many parts. It's a very complex structure, and we have to consider all of its component parts so that we can ultimately maximize its functional output. And that's what we here at Balanced Physical Therapy are experts at. We invite you to come and visit us in the clinic.